Hello, everyone, and welcome to the HEI webinar on health impacts of air pollution in East Africa. As some of you will know, HEI has been working in East Africa for a couple of years now, engaging with a wide range of partners on topics related to air pollution and health. And one of the things that we learned early on in our workshop conducted in Nairobi in 2023 was that there was a need to try and bring together the evidence and the data that existed in the East African region around the health effects of air pollution as a way of being able to use that data both to inform policy, to support policy actions that may already be underway, and also to identify where we really need further science and research to happen, where there may be data gaps that need to be addressed. And in response to that need, HEI brought together an expert panel, some of whom you will hear from today, to conduct a scoping review, essentially trying to map out what is the evidence out there that has been published on health effects of air pollution in the East African region. So we welcome you to today's webinar, where we will present some of the findings from the scoping review and also discuss where we go next. What are some of the future directions that seem most likely to bring us closer towards clean air action? We have a wonderful set of speakers and panelists, but before I introduce them, I just want to go through some housekeeping rules. My name is Pallavi Pant, and I lead our global initiatives at the Health Effects Institute, and really happy to be welcoming you. We are doing this as a webinar, so if you have any questions for speakers as we go through the agenda, please do put them in the Q&A box. We will have a dedicated Q&A period right after we present the findings from the scoping review. We will also have a period of open discussion at the end after all our speakers and panelists have spoken for you to chime in with your ideas and questions and thoughts, as well as feedback and suggestions. So please do stay engaged throughout, and we look forward to hearing from you throughout this session. The recording of the webinar, the slides, and related materials will be made available on our website. And if you register to attend the webinar, you will receive an email once those materials are on our website, but you can also get in touch with us in the meantime if you have any questions. Today's session is about 90 minutes, and we will spend the first half or the first 30 minutes talking about what we did as part of the scoping review, and then answering any questions that may come up. We will then hear from 4 experts who will present their views on how they see the findings from the scoping review, what their experience was. Some of them are members of our expert panel, so you will also hear their experience throughout the scoping review and where they see this work moving forward. And then, of course, we will have an open discussion at the end. So we will be hearing from 6 people actually throughout this session, including my colleague Victor Nthuzi, as well as 3 of our expert panel members, Dr. Karadi Wright from South Africa, Dr. Rebecca Nantanda from Uganda, and also Dr. Alex Nabachira from Uganda. We are also very glad that we are able to have 2 other guests join us who were not included as part of the conduct of the scoping review, but will be able to reflect on some of the needs and ways forward. Dr. Bertrand Fankam from Senegal, and also Dr. Bertrand Mbachu from Cameroon. Really excited for both of them to be here with us today. So without further ado, I will now request my colleague, Victor Nthuzi, to walk us through some of the key findings of the scoping review. Over to you, Victor.
Thank you, Pallavi. It's nice to see everyone. Let me just shuffle my screens here and share so we can begin. There we go. Presentation mode. Great. Happy to see everyone. I think this is the culmination of a long process that we've been undertaking as HEI throughout our engagements in East Africa. So I think I'll go through a few slides, just taking you through the process we went through to develop this scoping review. Hopefully, some of you have already had a look at it. It's a rich document, but I'll just look to highlight a few key messages. And this is the format in which we'll go through the presentation. So looking at the exposure side, so if you look at the second bullet point here, you'll see that, we found many studies using satellite data actually, and personal exposure measurements to quantify the exposure. On the health side, we did find a lot of focus on maternal and neonatal health outcomes. No studies yet on long-term exposure to air pollution, which is something we might want to look into. A lot of the studies focused, of course, on household air pollution, cooking and heating using biomass, which is a predominant source of pollution in the region. And in some of the conclusions we make in the report, we do sort of highlight that the evidence we are seeing in the studies that we did find in the scoping review is broadly sort of aligned to what we know already. So which sort of begs the question, do we need to wait for, more evidence in as far as we do also advocate for, locally tailored studies, which is important to sort of understand the situation. Can we already start taking action? I think is an open question that we will sort of highlight as well in the course of this presentation. So just jumping through to, so why did we do this? And this is an extract from some of the introductory parts of the report. So showing you where sort of air pollution lies in the broader sense of environmental risk factors. This is from the GBD study. 294,000 deaths is quite a huge number. But I think more importantly, it's a second leading risk factor, just next to child and maternal malnutrition. You see, sort of other things have gone down the list as time goes on. WASH, we know of the interventions there over time. So these and many other things. And I think as Pallavi laid out also, the scoping sort of workshop we held in now 2 years ago in March of 2023, where we met with all these experts from, I think, 5 different countries in East Africa. And they really highlighted the need for us to sort of understand what's out there in terms of evidence on air pollution and health. And sort of that's essentially where we started this process. So moving on, so how did we go about this? So we sort of searched for published literature on air pollution and health specifically, and in terms of the eligibility criteria for this particular review, we were looking at East Africa as 8 countries. So you all know of the East African Community, which is a regional economic bloc. So if you think of the East African Community without Somalia and then include Ethiopia, which is not a member, so you have Burundi, DRC, Ethiopia, Kenya, Rwanda, South Sudan, Tanzania, and Uganda. So those are the 8 countries. And we're looking at, adults and children in these studies. So we didn't close it up to any particular sort of age group. We were open to all studies spanning throughout. In terms of exposure, we looked at most of the criteria pollutants, so PM, particulate matter 10 and 2.5, nitrogen dioxide, ozone, and carbon monoxide in both ambient and outer environments. So I think what I should mention here in terms of what we did not include. So for participants, we did exclude studies that were looking at occupational settings. So for example, miners, we did see a few studies that looked at mining activities. So those were excluded from our search criteria. In terms of exposure, we did not include studies using low-cost gas sensors, mostly because we know of the uncertainty that comes with. We know there's use of PM sensors a lot, and there's we're increasingly confident of the use of those for health studies, but we sort of have issues with the gas sensors, so we did not include those studies. In terms of health outcomes, all of them were included, but we gave special consideration to, those that are relevant to public health and policy in the region. So a brief diagrammatic showing what we came out with. Lots of studies initially, 1,300, went through screening and ended up with 34 studies. All of this in terms of the process, how we went about it, how we summarized the data is summarized in the study protocol. And the QR code there will take you to the study protocol, which was published on OSF, I think in February of 2024. So now we have our 34 studies that we've sort of selected. What do these studies tell us? So a brief overview of the studies. We didn't find any study in South Sudan. A lot of multi-country studies, and we'll see this in some of the later findings. The distribution of studies here, Tanzania being the highest, DRC having 2 studies. In terms of the methods, lots of cross-sectional studies, a few interventional studies, 4 of them, one time series study. We did see one cohort study in Uganda, I believe, and they basically used a HIV cohort. It should be, yeah. They use some of their data to sort of link health outcomes to air pollution data. Something of interest probably to the community as well. There were 13 studies that used demographic and health survey data, which is sort of a cost-effective way of going about things. Instead of designing a whole sort of health study, you can rely on the DHS data to give you some historical sort of setup, and maybe you match that with your exposure data. This data may no longer be available, so also something for the community to think about in terms of going forward, what that means. I think one thing that stood out for us is most of these studies actually came online in the last 5 years. So 3/4 actually, going by the numbers. So we are seeing an increasing sort of trend towards health studies in the context of air pollution. There are many exposure studies. So studies looking at, air pollution levels in mostly in capital cities, but also in other secondary cities. Those have been there over time, but we are seeing an increasing trend in the last 5 years. Our cutoff date for this scoping review was December of 2023. So we are seeing an increasing trend in sort of going towards the health direction, maybe to make a case for why air pollution, air pollution and health is an important intersection. So going step by step to look at the exposure bit, or air quality monitoring, if you will. So this is just a summary of GBD data as well, just to give us a sense of the trend. I think the critical thing to say here is, however low, countries like Tanzania look like in the broad context, it's still, at WHO interim target 3, which is still quite high, commendable, but also high. Uganda, Rwanda, Burundi, well above interim target 1. This is for PM 2.5 annual average. And I think interim target 1 is 35. The air quality guideline should be 5, if I'm not wrong. So yeah, in the broader sense, still above, well above WHO targets. We did find that most studies looked at, PM. And in terms of techniques, satellite data was one of the most commonly used one. Personal exposure measurements. So essentially, having study participants wear monitoring equipment on them, track them throughout the day, doing their activity, get some activity data as well, correlate that to health outcomes. 12 studies using indoor and outdoor measurements. I think the thing to stress there is we do have a need sort of to maybe also have more, reference monitoring stations. In these 12 studies using indoor and outdoor measurements, only two were referring to regulatory monitoring network data. So also something for us to sort of think about. So that's the broader sense on the exposure side. We did not we weren't able to, because of the difference in sampling times, monitors used, analysis and all that, we weren't able to sort of summarize in a concrete way, like give an average concentration from all these studies. Each study used a different approach, different timing, some for 8 hours, some for 48 hours over 24 hours. So we weren't able to sort of give summaries of what the numbers look like in terms of PM 2.5, carbon monoxide, or nitrogen dioxide levels, average levels from all these studies. Nevertheless, we did look more on the health side. So what are the actual health effects that were coming out of these studies? The point I think to make here is this affects you from birth to throughout the life course. And as you can see, from maternal and neonatal health, increased risks of infant mortality, pregnancy losses, in children, wheezing and coughing. Most of the respiratory outcomes were of greater importance. Some studies on cognitive development as well, stunting, and a lot of studies on reduced lung function. So, I mean, associations were drawn for instance, in children with increased risk of mortality. In adults, most of the adult studies were in occupational settings, actually. Taxi drivers, bus drivers, in some cases in the DRC, and there were associations with increased respiratory health effects from their occupational exposure. In more vulnerable populations, older people, increased risk of respiratory and cardiovascular diseases as well was seen in some of the studies. So I think one of the other objectives, if I move on to the next slide, was also to sort of map out so what are the health outcomes of interest in the region? And we categorize them in this sort of 5 main classes: cardiovascular, child health, maternal health, neonatal, respiratory, and others. So by far, I think child health and respiratory health were the most studied. I don't know if that has anything to do with the capacity on the region or the interest level of interest, policy interest. I think that's something still out there. But as you can see, lots of child health studies and the maternal neonatal health studies were also quite important in some of the countries, Rwanda, for instance, and Tanzania. So just to give you a flavor of what we saw from this study. So, well, what does all this mean in terms of going forward? I think we will have dedicated session to look at or to hear from the experts the expert panel that we engaged in this process. But broadly speaking, these are the 4 kind of recommendations that we offer based on what we are seeing from this effort. So the first one, I mean, expanding air quality monitoring in the region is something we've, I think, discussed over time. Just making use of that data, and not just having that data accessible, I think, is one thing. Having the monitoring networks operational is another. But more importantly, marrying the two, so air quality data and the health data. So integration of air pollution into healthcare data management systems. So we can start drawing those associations and engage broader communities, both on the environment or MET side, meteorology side, who also do some monitoring, and really start making sense out of, what are we seeing in terms of NCDs, increase in certain disease outcomes that we are seeing in our countries. Using the existing data to inform policy and increase public awareness, I think goes without saying. The more we have, and in the report, we go into a bit more detail in terms of the ongoing programs just to mention a few, the Eastern Africa GeoHealth Hub, the Clean Air Africa Project, and others who are really doing good work in sort of highlighting things on the ambient air pollution side and the household air pollution side as well. So we do acknowledge that those efforts are there. And, we need to bolster those efforts and a bit more coordinated in terms of the region, and looking forward to how we translate all this great science into sort of policy interventions or policy uptake, which is an effort by itself. So before I move on to the last slide, just to acknowledge that all of this is thanks to our panel, pictured here with some of the HEI scientists. So it's not recommendations that are coming from the blue. It's from the experts in the region who have really taken time to look at this evidence and what it means. And we thank them for that effort. And of course, our funders who have funded this effort, the Clean Air Fund, we do want to acknowledge them for the financial support they have offered to us in this process. So as I conclude, this is a resource that has been there, but we have sort of revamped it and gave it a nice new name, Linda Hewa, which is a Swahili name for protect your air or protect your atmosphere. So what we did in this sense was all those 1,300 and something papers that we uncovered during the search, we sort of fine-tuned them to those that are relevant to the region. And in this map, you do see the 8 countries that I referred to. And we added all those papers, including the 34 that are included in the scoping review, to the database. It's a resource that's available to all of you that you can use. And interestingly, after that effort, so Kenya had the most studies, but now Ethiopia has, I think, about 98 studies. Kenya has 88. So the darker the color, the more the studies. And we are open to receiving your requests on. If you scan this QR code, it'll take you to our website where you can reach out to us so we can add this paper. But we want to make this resource available to you as part of our ongoing efforts to enrich the strength of the evidence and in the region following the release of the scoping review. So that's what I had. I think the idea for me was just to present a few of the findings and sort of elicit a discussion and see what ideas you have. I think it was a great effort from our side, a very interesting thing that we came out with. Some findings we weren't expecting, but we look forward to engaging with you and having further discussions. These are some of our contacts on social media as well, and the QR code here takes you to the report just in case you haven't seen it already. So I'll stop here and see if anyone has any questions, and our expert panel will also be helping us to answer any specific ones that come through. So thank you very much. Back to you, Pallavi. I think I'll stop sharing.
Thank you, Victor, for this very quick tour of what this project did. And I think before we move on to questions, I would like to request Dr. Rebecca Nantanda to supplement, as a member of the panel, your experience working on this and also any reflections. And all of you listening in, please add your questions to Q&A. We're going to go right to that after we hear from Dr. Nantanda.
Yeah, thank you, Pallavi, and thank you, Victor, for the very, very nice summary, really making all the points that we discussed. Now, as we think about future directions and reflecting on the report, one of the things we must have is the context. We know that although the report was done in East Africa, most of the East African countries are not different from Africa, and the rapid population growth is a key factor to think through as we move forward. And what does this mean? This means that we are going to have more people using, for example, cars and therefore generating more traffic-related air pollution, more construction going on, industrialization, more waste coming in, and how best to manage that, because all these things contribute to air pollution. But also it has been predicted that in the next 25 years, we are going to really be having an increase in the rural-urban migration. So all these factors put together going to increase both the outdoor air pollution or ambient air pollution as well as the indoor air pollution. Now, the other reflection we need to make as we think through whether research or policy or in actions, whereas we are having studies that talked about indoor air pollution, household air pollution, and ambient air pollution, sometimes there is a thin line between the two, especially in urban settings, in a way that if you have household air pollution, it greatly contributes to the outdoor air pollution. And so as we think through interventions in the future, as we think through the actions, we also need to have that context at the back of our minds. Now, from the way I sit as a pediatrician and research scientist, of course, health is very critical. For a long time, we've been thinking about air pollution and with little really relating it little to health. But I think this is the time to start generating even more concrete evidence about things like the long-term effects of exposure to air pollution. And one of the reasons we emphasize this is that as healthcare professionals or as people who are trying to increase awareness about the air pollution effects on our health, many people are still struggling to see that link between their health and air pollution. So if you're able to generate this kind of more granular evidence in terms maybe of cohort studies, I think it's going to be very helpful in creating awareness, but also in trying to understand this better and creating more relevant interventions. And then lastly, I think for us healthcare professionals, some of us will see the patients, but also even if you're working in the public health system, I think it's time for us to start incorporating air pollution into the health system, whether it's in the clinical room when you are clerking a patient. I'm looking to that time where we are going to do the same thing we do when we are talking about tobacco smoke. For example, when you see a pregnant woman and you're asking about the different risks, we should start asking about air pollution exposures. We should be having this messaging, for example, in the antenatal clinics, in immunization places, so that it becomes more and more clear to the people and how they can avoid exposure to air pollution. I think that would be really a great way to improve awareness, but also for us healthcare professionals to be able to interact with the people who may be directly affected, like the patients that we see. So it's time for us to include that in the health systems, to capture that data about air pollution and the health effects, because like you've noted, these studies can be very expensive, but if you're able to really get good data through the health system, and we use that data in line with the air quality monitoring, that is, we hope that can be done routinely and very widely, then it becomes much cheaper for us to develop these, these trends and associations and explain some of the, the disease burden that we see that is related to air pollution. So I will stop here for now, but thank you very much, Pallavi, and thank you everyone for really joining this very important webinar.
Thank you, Rebecca. I think that is, those are really useful points and things that continue to come up in so many conversations. We have a couple of questions that I will share here, and Victor, perhaps you can start, and then we'll also request our other panel members to chime in. One question, which of course is something that is critical to all of this, is in terms of action. How many of the East African countries have air quality related laws? Because often, setting up monitoring stations and following those trends, looking at the air quality monitoring data can help. So this is a question from Janine Wickman. Janine, very nice to see you on this webinar. Thank you for joining. But yeah, Victor, maybe I will ask you to perhaps start on this question, and then Alex or others on the panel, if you want to join, add your thoughts on air quality regulation and the policy framework related to air quality in East Africa.
Yeah, so thanks, Janine, for that question. In fact, I may use the South Africa, East Africa comparison to answer it. So I think we have a section on the policy landscape in East Africa in the report, and it's a tricky one to answer. So there we do look at ambient air quality standards, which for me are one aspect of air quality laws. So the approach I've seen in East Africa for the longest time, or that has been there, is we set up environmental management acts that have everything, water, air, and all that. Then you follow those up with regulations. So you have an air quality regulation, for instance, that specifies what you want to do in that sense. Then you have standards. That's another level that are actually managed by Standards Bureau, not the environment folks. So that's one way of looking at it. I mean, the South African example is a bit more advanced in terms of how that has grown over time. You have, national level ministries that just do the policy and the direction, and then you have municipalities and regions that do the actual monitoring. And that's where I think maybe East Africa should go. But nonetheless, we do list countries that have ambient air quality standards, and only 2 of those, Burundi and DRCs, do not. But that doesn't mean they don't have air quality laws. And this is where it gets a bit more confusing. So at the East Africa level, we do have the East Africa Community. We do have vehicle emission standards and air quality standards, actually. And in the report, in fact, we refer to the East Africa Community laws that say once we pass a standard at this level, after 6 months, if the country has not domesticated that standard, it becomes enforceable by default. So because we have an air quality standard at the East African level, you can assume that all these countries under the ESC do have an air quality law. But that's being a bit sort of optimistic. In reality, things do not always play out that way. So I would say the situation in East Africa is maturing at best. Some laws are there, some aren't there as yet, but we do note that it's something that we need to look at. And the focus on health, I think, is health and environmental integrity is one that makes a good case for that. So that's a long and complicated answer, but hopefully it gets to what Janine was asking. Maybe Alex would want to also chime in.
Yeah, thank you, Victor. I am Alex. I work with the City Authority for Kampala City, which is a country in Uganda. I mean, in East Africa. I think, Victor, you already said it. You have good experience with most of these East African countries. Specifically, if someone is talking about air quality laws, they may not be, stated as that. But looking at the legal regime that we have in most of these countries, they actually adequately address air pollution issues. And that's at the national level. Maybe what you did not add is that now majority of cities have come up with bylaws, or call them ordinances. And these are very specific for air quality management or air pollution control. Maybe the other aspect that we need to note is that air pollution management or mitigation is actually has steps in many sectors. It's smart sector. So while you will not have a law that specifically says this is air pollution, air quality, you're going to have many bylaws or even national laws, which when you review and read them, they seem like actually their main target is air pollution. And so these are in different sectors. Could be in health, could be in transportation, and road safety, could be in environment. But you clearly see that air pollution is one of the main aspects they are targeting. And also the beauty about that is that mitigating air pollution or addressing it also usually has multiple benefits. There are not many actions that just result into improvement of air pollution, of air quality only. By the time you improve the air quality, certainly you have streamlined traffic flow and people are not spending many hours in jam. Maybe you have already improved the cooking experience. So it's most of these are already captured in other bylaws, not specifically mentioning air pollution, but ideally the primary outcome, air pollution. And lastly, it looks like we already know, especially in the East African community, that air pollution has no borders. So like Victor said, anything that has been made, for instance, we have the East African air quality standards. So if you are one of the member states and you don't have, then we apply that to you. So why you bring like very old cars beyond the cars that everyone is saying you bring in? So it's something I would say that in a nutshell, the rules are there. Thank you.
Yeah, thank you, Alex and Victor. I think another question that came up in the chat was around, whether we see the most data for cooking or, emissions related to cooking and household solid fuel use is because there hasn't been sufficient work done on other sources and not because those other sources are not important. And I think this was also something that the panel discussed quite a bit, just given the skew in the number of studies available on household solid fuel use compared to some of the other major sources of air pollution. And I'm wondering if anyone on the panel or Victor also want to add any reflections on that, considering that household solid fuel use is an important contributor in this region, as Rebecca also pointed out, but we do see very few studies on some of the other sources like transport or waste, construction, etc. So, Victor or anyone on the panel, would you like to comment on that?
I mean, I can go first, and just from the point of view of the source apportionment studies, I think that's maybe what this is alluding to. Yeah, I mean, there's very few of that. We had actually a workshop in February of this year before we launched the scoping review report to discuss preliminary findings with about 40 participants from I think 6 different East African countries. And one of the things that we did acknowledge in that meeting is that we need more source apportionment studies. So whether that's to sort of determine which sectors to target. In most cases, we think about transport, the kind of stuff we see, waste management, open burning industry, but to what extent this contributes. So there's 2 approaches. You can do source apportionment studies, you can develop emission inventories as well, which is a bit more of an expensive process, I think. So the approaches are there. We maybe are not using them to the effect that we should. So just to say, maybe, I can't say for sure whether that's the reason why we are seeing a bit more focus on household air pollution compared to other sectors, but sometimes the evidence does drive the kind of techniques that people prefer to use. I see Bertrand also wants to chip in here.
Yes, thank you very much, Victor and Pallavi. Yes, what I wanted to say is, what we just said is that we have been focusing on PM 2.5 most of the time when we are making our studies here. And when we make this investigation on PM 2.5, we are just looking at the level, at the exposure most of the time. And we don't look at the source, and we don't look at the chemical composition most of the time. And the reason why we are not looking at the chemical composition is because we don't have instruments, because you need analyzers in order to do that. And most of the time we don't have it. Now we are working on PM 2.5 because we have just local sensors that are cheap, okay, that we can afford. But when you got to buy an analyzer or a microbalance, it costs a lot. So it's a lack of instrument that makes that most of us are not focusing on chemical speciation. And when it comes to source apportionment, it's almost the same, because you need first to have the chemical position before you can get the source apportionment. Otherwise, you cannot work, you cannot have the source apportionment. So both of them are linked. So you need an instrument for that. That's what I want to say. Yeah.
Yeah, thank you, Bertrand. I think that is such an important point, especially on, a lot of times decisions about what kind of science or research is conducted also depend on what resources, facilities, and data you have access to. And we do see that reflected in what gets published and, what kind of work is taken up more often. One of the other things I'll just, highlight before I go to one of our expert panel members next is also that our focus in the scoping review was primarily on studies that looked at air pollution and health, studies that looked at the association between air pollution and health. But one of the things that is very, very heartening to see, and also saw a comment from Deo Okure in the chat, is there were, more health studies in the last 5 years, which is great, as Victor pointed out. But at the same time, the number of publications and the types of data that is now starting to become available on the air quality side, both from low-cost sensor data, from satellite-derived estimates, or even other efforts to do more local measurement of air pollution, is fantastic in East Africa and also in other parts of Africa. So hopefully we will hear more about that from Bertrand in a few minutes. But first, I would like to invite one of our panel members, Dr. Karadi Wright, to again share her reflections from this exercise and opportunities that she sees for moving forward towards progress. Karadi, over to you.
Thank you very much, Pallavi, and thank you to my fellow panelists, as well as friends and colleagues who I see online in the list of meeting attendees. So this was a really exciting project to work on. I'm very grateful that I had the opportunity to do so. It was, I think, revealing, because I had anticipated there being less studies that we could include, given the emphasis, as Pallavi has mentioned, on both air quality and health outcomes. And what I want to reflect on just for a few moments is the kind of findings that we came up with from what the evidence that we were able to retrieve. I won't reiterate what Victor has said, but just those that really interested me. The nature of the pollutants. This has also been mentioned as well. I think Bertrand might have mentioned it a moment ago. And then, what are some of the synchronous challenges that here in Southern Africa we are facing, similar to what we have noticed in the East African countries in building this evidence base. So to start with, I just thought it was fantastic that we had more than 20 studies that we were able to include that had incorporated both health outcomes as well as the exposure elements. Working in this space in Southern Africa, but also across Africa, I know how expensive these studies are. It's difficult to find the funding for them. We are able to leverage on the climate change angle at the moment and include air quality and temperature in this work. But it's great that there are researchers who are passionate and really chasing this growing evidence knowledge base that we need. At the end of the day, this is the information that supports policy making, decision making. And when you have good relationships with these people in your municipal or in provincial or national governments, you can really feed this evidence into the decision making that they need to make, to take action or to revise policy or the bylaws that we heard about a moment ago. I was especially interested in the maternal and child health aspect of the review. It's well known globally from many studies that we've seen overseas that there are impacts on maternal and child health from air pollution exposure, as Victor said, across the lifespan. But to find studies like this in East Africa, I think was really commendable. The child growth and development concerns, wasting and stunting in Africa is a major challenge. And it was good that we were able to find the evidence to support this, and hopefully we can use this evidence to lobby for change. This was over and above what we had anticipated finding. For example, increase in child mortality, increase in respiratory infections, even things like anemia, and obviously respiratory and cardiovascular disease in our adult populations in East Africa. Again, PM2.5 did come out as the pollutant that was most monitored, and I've reflected on why. I think we are seeing, and we have seen in recent years, an increase in low-cost sensor monitoring in lieu of our reference grade monitoring networks. This is great, but unfortunately, low-cost sensors are not performing as well as they could be for gases. So particulates are much easier to measure with low-cost sensors, less so for gases. So we have a long way to go in improving our low-cost sensor instrument development. And I think that there's a responsibility on the researchers, such as myself, to work with the technology developers to try and improve this necessary type of measurement for gases and volatile organic compounds, for example. The other thing that I was pleased to see is that there's also evidence for Africa, as there is from India, that cook stoves, in terms of interventions, have been successful. And I think that this is something that we should try and ensure in the research community, that when we are engaging in these studies to gather the evidence to support policy change and decision making, we shouldn't stop there. We should really work with the implementation scientists to intervene using the most appropriate, locally acceptable interventions that can reduce air pollution in the breathing zone. In the household environment, we know that there are some solutions that work, as difficult as they are in terms of behavioral change. I'm focused on those. I'm not thinking about transport and industry and other things that can be managed differently. But I do think we should turn our attention to this, seeing as we do know that these cook stove interventions can be successful. And then the bring home for me for Southern Africa is that we do need a coordinated effort. The funding is not always available, so we do small ad hoc projects. We monitor for a week or 10 days because that's all we can do with the funding that we have. Possibly if we coordinate our efforts and work more closely together, both in Southern Africa together with East Africa, we have much to learn from what's going on in East Africa. Coordinated efforts across these two regions could really see progress being made even here in Southern Africa. I didn't think that there would be scant evidence, and I'm glad to see there were more than 20. Of course, we would love for there to have been more, and so I'm just encouraging all researchers out there to think about ways to collaborate across regions. Let's think on an African continental scale to come up with these evidence building intervention based studies that can really help improve equity, reduce exposure, and ensure quality of life for the African population. Thanks, Pallavi. Back to you.
Thank you very much, Cardi. I think that the closing message, especially that you have around the need to collaborate across countries and across the continent, is really a powerful one. And I know that this is one of the things that the Pan-African Thoracic Society has also been focusing on, both training clinicians to think about air pollution, and to also think about interventions that can be introduced. And we're very glad that Dr. Bertrand Mbachu is able to join us from Cameroon. Bertrand, can I request you to please share your reflections? Bertrand, we have two Bertrands on the call, so I'm pretty sure I'm going to do this multiple times. But I'm hoping for our colleague from Cameroon, representing the Pan-African Thoracic Society, if you're able to hear us, and if you would like to share your thoughts. And then Bertrand from Senegal, I'll come back to you in a couple of minutes.
Thank you very much for giving me this opportunity. I'm sorry because my camera is not working and I cannot see my face, but I'm happy to join the panel. I was a little bit late because of my clinical duties in the hospital, being basically a medical doctor. So I didn't follow the first presentations, the main presentation, where I just caught up with comments of different members of the panel. What I can say is that air pollution, as you have said, is really a great concern, health concern in our continent. And we really need evidences on indoor and outdoor air pollutions. And I think we are moving a little bit, maybe slowly, but we are having from years to years studies being done in different parts of the continents. And the topic today is the East Africa, where I think a lot of study have been done, less in central and western part of the continent, but we are starting. So I'm from Cameroon, and we have started with few studies using low-cost monitors, because in most of our countries, especially French-speaking countries, we don't really have policy as national policy on air pollution. So we are still to gather data and then advocate to policy makers who are those to take decisions at national level. So at the level of Pan-African Thoracic Society, since 2026, so we have been organizing every year one course training on research methodology, and we have had participants from various parts of the continent. And for now, about 10 years, we are organizing for each session pre-course workshop, and we always organize pre-course workshop on air pollution measurement. So, and I think as a result, we have had many studies conducted in different countries where the learners were coming from. So, and we are keep going with this training on air pollution measurement. And something else that I would like to add, apart of gathering evidence, we also need the training of the health personnel, because what you see is that in most of our medical schools, there is no really specific focus on air pollution as a risk factors of respiratory, of cancer, of cardiovascular diseases. We can just quickly see it in some of the lectures, and I think that's something that needs also to be discussed with medical schools in terms of curricula. And I would like to thank WHO, which has now developed tools for health professionals, and I think some of our countries use these tools to train their personnel. So that's the second aspect, and the final one will be also to gather evidence on the relation between air pollution and health, to have our own local studies. There could be a cross-sectional or cohort study, really to show that in our setting where we have air pollution, and mostly indoor air pollution, we can show that, okay, some of the cases of cancer, of chronic obstructive lung disease or asthma are due to air pollution, whether indoor or outdoor air pollution. I think we should keep working on the topic and having collaboration work or research, and by that way, I think we could in the future have really great awareness and decision from policymakers, which will help us to really fight against air pollution and all the health consequences. Thank you.
Thank you very much, Bertrand, both for highlighting, what the contributions or activities as part of the Pan-African Thoracic Society have been, but also this need for really expanding the work. And I'm going to channel Carly, as she just said, sort of collaboration is key. And also on the, not just on the health side, but on the air quality side and across both And Bertrand, the other Bertrand, who's joining us from Senegal, has also been leading an effort to bring together scientists from across the African continent, focusing more on the air quality data side. So Bertrand, would be great to hear some of your reflections and gaps and opportunities that you see for us moving forward. Over to you.
Okay, thank you very much, Pallavi. I first want to thank you for your efforts in order to gather us here and discuss this important report you just published with your team. It's also very good to have this kind of review, because this is something that is also missing here sometimes in Africa. It's good to have publications coming from here and there from different countries, but also it's good to have a review, okay, that summarize the findings that we have on different people and make comparisons on different situations, on different contexts. This is also very important. That's why I want again to congratulate you and your team. So I just want to go to some specific points that I've seen on the in the report and comment on that. And the first one is concerns the paucity of data, of studies also, of data and studies also. This is something that is that we have made as constatation also, okay, that we lack studies in Africa. This is something this is important. And I would take the single case of DRC. You had just 2 publications, and DRC is the biggest country in Africa, 100 million inhabitants, but we have only 2 publications coming from this country. So you can understand that we really need studies in this country. It's a very large country also at the same time. So this is something we need to focus on it and to see how we can have more and more studies in Africa. If we don't have the knowledge, we cannot solve problems we have. So we need to build knowledge on the problems we have. So we need more and more research, more studies in Africa. I have checked in the past in order to know what could be the percentage of publications coming from Africa when it comes to in the field of air quality or air pollution. And I realized that we have less than 1% of studies, okay, coming from Africa. This is very, very, I mean, it's very, very low percentage that we have. So the contribution of Africa in this science, in the field of air quality is very, very, very low. But nevertheless, what we are seeing is that the number of publications is increasing constantly. So I have checked also the data, some databases in order to know how the number of publications is evolving since the 1950s or 1960s. And what I found is that before 1990, most of publications that were before 2000, I would say, most of publications that were most of studies that were carried out in Africa was carried out by our colleagues from the UK, from the UK, from the US, from France, or from Germany. So most of publications were from the north, from Europe countries. So our colleagues were coming here making studies, and we were not even aware of that we were making some studies here in Africa. But since then, things have changed a lot. And we have seen that there are countries like South Africa, Nigeria, Ghana, and Kenya, where we are having a lot of publications coming from those countries. And we feel that in years to come, I think we are going to have more and more publications. So there is hope that the number of publications, the number of studies in Africa will increase. This is for sure. Something also that is important, I think some of you also I've also seen that is the lack of data, the lack of data. When it comes to PM, when it comes to ozone, when it comes to SO2, and so all these criteria pollutants. So we don't have data. Several times I've gone to the OpenAQ website, because they have a platform where you can go and check where they have some sensors in around the world. So when you select PM 2.5 and you look in Africa, you can see some sensors here and there, but very few sensors in comparison to other places around the world, like US, Europe, or Asia. And when you change now, you go to, let's say, O3, ozone, and you click, you select ozone. You don't have very few monitors, and those monitors are located in South Africa. So the rest of the continent, you don't have any single monitor that can help us to know the level of the exposure to ozone. You see, and the same thing apply to SO2 NO2. So this is a constatation that we can see from this platform. So now that we know that we don't have studies, and we know also that we need data. So the question is, what is the best strategy then to extend air quality monitoring in Africa? This is the question. To my opinion, we need political will. Individually, we can buy some monitors installed in our courtyard, close to our office. We can do that usually. But in order to make good studies, in order to monitor, to make impact, okay, on the population, we need political will. This is very important. Without political will, we cannot achieve anything. We need to have decision makers on board. This is very important. Second thing, we need to get institutions involved. Government agencies, research centers, municipalities, businesses, citizens. We need all those people, institutions to get involved. Now, when it comes down to go on the ground and to have the data, to generate the data, all the techniques are welcome, and they are even complementary, most of them. We need ground instruments, we need remote sensing, remote sensors also at the same time. We need all of them because they have some specificities. With ground instrument, we have local data on the ground, but you need also to make some, let's say, regional studies or global studies. At that time, you will find that it's maybe better to use a satellite data. Okay, so both of them are also important. So, but we need also at the same time some models. We need to develop some models also at the same time in order to predict, okay, the pollution in specific areas. And as mentioned earlier, when you measure the PM 2.5 and you say, okay, I have 50 microgram per cubic meter, but the information is incomplete. By the time you don't know the source and you don't know the chemical composition, the information you are having is incomplete because you cannot use it for a good action. Because when you need to act, you need to know where this PM is coming from and and you need to know also the composition at the same time. So it's very important to have this complementary information. By the time you know that, okay, I'm having here PM 2.5, okay, this is the level 50 microgram and 50% is coming from traffic, you know that you need to act in priority. The priority should be on the traffic. But if you don't know the source, then you sometimes the information is incomplete. This is something important I wanted to highlight here. Now I'm going to talk about something that is also important. It is we talk also about it. Karaji mentioned it also. Is the funding. This is a critical issue. I read in the report that yes, most of the data were generated from projects. So a project will last something like 2 years, 4 years, maybe 5 years maximum. So what happened after those 4 or 5 years? So everything is shut down, and we don't have any data. But we cannot make a good monitoring like that. No, what we need is sustained funds in order to do that. This is very important. And something also that I found is that most of the funds that we are having in Africa in the field of air quality, okay, when it comes to deploying monitors, these are funds coming from developed countries, not from Africa. Close to 80 or 90% of those funds are coming from the West. But we cannot build a long-term policy with the funds coming from the West. This is not possible. We need local funds here in Africa from our governments in order to have a sustainable policy. I've visited some agencies where some governments or some municipalities have bought local sensors and also sometimes some high-grade monitors. But sometimes when you arrive there and you want to visit the station, sometimes it's not in operation. Why? Because of lack of maintenance, because of lack of budget in order to sustain the operation of the monitor. So we need this sustainability when it comes to generate data. This is very important.
Yeah. Thank you, Bertrand. That was, I think, a really good set of messages and perhaps something for us to dive into a little bit more also based on the comments. I think since we have invoked policymakers and decision makers a few times, I want to bring on Alex Nabachira, who works at the Kampala Capital City Authority and has been at the forefront of air quality decision making at the city level. So Alex, over to you for your insights.
Thank you. I think I was just start it off from with my experience, especially working with the city. Most cities, of course, are subnational governments, so they tend to follow the recommendations and guidelines and laws, the national ones. But most times, they move faster than the national governments. It's actually not. It's quite common to find that ideally national level parastatals benchmark cities in as far as moving forward and moving fast is concerned. And air pollution is one such example. When you look at most of the studies we reviewed, most of the monitoring was happening in urban areas. Of course, we still know that in Africa, we have a substantial population that still lives in the rural setting where we don't know what's happening. And it's difficult to rally people like those ones to behind this cause. We know they have household air pollution, very significant, but because they have breaks when they are not exposed, when they are in gardens or in places that are considered safer, it is difficult to convince such people. So we linking air pollution and air quality to health outcomes, to public health, to me, and from what we've seen, seems to be an important and missing link. We've seen over time that when we, in most places, actually even in developed countries, if you link something to my health, I take it more serious because something that affects your health is actually an important thing. So moving ahead, we need to find a way of packaging the air quality or such studies information or any other studies that are association between health outcomes and air pollution and air quality, to find a way of how this can be packaged and presented to policymakers, but also to politicians, so they can actually understand these facts the same way we understand them. I think that's the only way, like Professor Solomon was asking, how we can convince them. We have not, in my experience, for instance, I have not spoken with any policy maker who actually fails to get converted, who doesn't see that air pollution is a challenge once you have explained and they have understood. So given that they are willing, it's now sort of lack of knowledge, failure to understand the facts that causes all these issues that we are saying. Like I had said earlier, we have an opportunity, of course. The challenge we are fighting is a moving target. But the beauty about it is that it's multi-sector. Even when you do not have funds completely allocated to addressing air pollution, if we have air pollution in all policies, then you will, most of the actions that you'll be taking either at an individual level or at government level or at an institution level will have a component that will support air pollution mitigation. The other one that moves in that line is prioritization. Because we are having for outbreaks, and we all know, for instance, how outbreaks present emergency situations that call for emergency decisions and emergency measures, you realize that in the government sector, they find it so hard to prioritize something that kills slowly, if I can use that word, and that's air pollution. It kills you day by day. It will be hard to prioritize it when you have an infectious disease. So in the process, the budgets that are not enough get prioritized with emergencies, and you find you are in emergency after emergency. So the only way we can package this and it gets support and we get the momentum that we want is linking it to the health outcomes. Lastly, just like we were all surprised, we did not think we were going to find these many studies, even if some of them did not meet the criteria for this particular scoping review. To a certain extent, they were studying air pollution in the region, and that was very exciting, especially in the most recent years. So that means that already we have some data that we can use to take action. It's important to collect more data, to do more monitoring in areas where we are not monitoring, to monitor gases, to monitor pollutants we are not monitoring, to do source apportionment, to identify several other causes and understand which sectors, for instance, are responsible for pollution given the area. But even the little data we have is enough for us to start serious action. And maybe the additional expansion of the monitoring is two-way. You're monitoring more, but you're also monitoring the effect of your interventions to mitigate the air pollution. So I would love to alert everyone that the data that we have is sufficient enough, especially from a government perspective when you want to take action, for you to take action, because I do not need a reference grade monitor to know that tarmacking this road has improved air pollution. A simple low-cost monitor may actually help me to do that. And given that already, of course, we are seeing that air pollution has no borders, we are coming together to confront it as a region. We've seen previously that regional declarations, regional networks, and regional positions have dragged some countries into taking action where they would have lagged behind. For instance, in East Africa, when we did the air quality, East African air quality standards, the countries that did not have were either forced to apply that or start developing their own standards. So it's, and like I typed in the chat previously, our regional network for the East African community was a bit weak, but now it's getting stronger. You need to know that it's very difficult if leaders are not integrated, that you can integrate at technical level, that the Ministry of Health of Uganda is working very well with the Ministry of Health of Kenya. The whole ministry is headed by a politician. So when there is a lack of political integration, there are several setbacks to the integration of the technical officers on the ground. You end up working under, UN agencies, for instance, like UNEP can bring you together as Kampala, Uganda, Tanzania, Ethiopia, World Health Organization, but those are not political institutions. These are largely technical. So now with the integration of the East African community and the interest that our presidents in the region are putting in and all politicians, we hope that we'll be able to confront this better than it is currently. Over to you, Paravi.
Thank you, Alex. I think, again, really good points. And the part that I like the most is, we have what we need to really take action, which is one of the messages that we did want to share through this work. There will continue to be need for more science, more evidence, more specific answers, better inventories, but there is sufficient data to start taking action on air pollution. We also have a number of really excellent questions in the chat and the Q&A box here. I will try and group them since we have limited time left now. One of the overarching themes, which I think came up as we were doing the scoping review, but also as we heard from all of you today and in the comments, is the issue of both access to resources, funding, but also, one of the participants has commented that in addition to funding and resources, the issue is around academic preparation and whether there are sufficient people getting trained to do work on air quality and health. And I'm wondering if anyone on the panel, I will request you to keep your responses short if possible, so we can cover all of the questions here. But any further reflections on the issues around access to funding, resources, and also, how much are the younger generation, the students, either on the medical side or on the, environmental side or public health side, getting trained to be working on this topic? Any thoughts or reflections from anyone?
Thank you, Paravi. Maybe I can just quickly jump in, especially the training, the mentorship of the young people. For instance, here in Uganda, we've realized that one of the main challenges for postgraduate, especially even undergraduate learners, is research fees. So what we have done, we've approached universities here that teach environmental and health and told them there is data here. As long as you're going to use it for academic purposes, it's freely available. And then we partner with them. So the learners develop their research proposals, knowing that there is free data already collected for me. And with good, it's accurate data, it's good quality data. And that way we are interesting their researchers, the universities, but also the learners, because tomorrow these are going to be very big people managing this. And while we just started, we have not yet seen the benefits. The number is increasing. Now we can't meet the demand because every day you have so many learners. So I think that's one way of interesting the younger people. So sort of, if they would have done research or dissertations in air pollution, and would have been prohibited by funds. Now as government, we have eliminated that. We say we have data here, come and use it as a student. Over.
Thank you, Alex. Anyone else wants to comment on this topic? I think it is something that is front and center everyone's minds a lot of the time. A related question, perhaps I will just add to this, is around whether global bodies such as UNEP or WHO, in addition to supporting work to set up air quality monitoring, for instance, UNEP has supported that work in many places. Are there any efforts that you're familiar with where global bodies like WHO or UNEP are supporting work linking air pollution with health? I don't know if anyone is able to comment on any existing project or any past projects that may have looked at that relationship, Victor?
Yeah, so I mean, maybe I can look at two. So normally on the continent, there is happenings where ministers do meet. For example, ministers of environment have a yearly convening called the African Ministry Conference on Environment, ministers of housing and ministers of health as well. So there has been in the past a convening of both ministers of health and environment led by WHO. The last meeting I think was either 3 or 4 years ago, specifically for the African continent. So that's one. The more recent one I think we have seen is at the last United Nations Environment Assembly. There was an air quality resolution that was passed. And one of the things that was in that resolution was for the formation of an Africa Clean Air Partnership that should be led by, I think, UNEP and the Climate and Clean Air Coalition. So that's still in the early days. I think some people who are on this call are involved in that process. There should be a first meeting in Ghana, I think, in a month or so to sort of start looking at what that process looks like. And I think it's also in collaboration with the African Union. So that is more on the continental side. But with respect to air pollution and health, I think the only one I can think of is this convening of ministers of health and environment.
Yeah, and I think, just in addition, there have been efforts more localized in particular cities in Africa as well, where WHO has worked with the city to develop health impact estimates. So not always trying to study the association between air pollution and health, but in some instances also thinking about, what the health impacts are, and therefore what benefits there may be in reducing pollution level. One other question, which I think again go to the very fundamental question around data, or the fundamental issue around data, is access to health data. And we saw in the scoping review that a lot of studies utilized existing administrative data sets and surveys, like the demographic health survey, for instance. But a question from Dorothy here about, lack of electronic records. And this is something I remember in the panel we talked about quite a bit. And it is not an issue unique to the African continent. Even in South Asia and in other places, we have seen that not having electronic health records makes it harder to both access the data that may be being captured just on pen and paper. It may not be consistent across different hospitals or different healthcare centers, so it makes it harder to compile it and use it for any kind of health study. And I'm wondering if any of our panelists want to reflect on it, either based on your experience working with these data sets, or where you see opportunities for better digitization of health data, which can help with the conduct of some of this work. Rebecca.
Yeah, thank you, Pallavi. I think the issue of health data is very critical. I remember, I think 2 years ago, we tried to look at health effects and then the air pollution, and we wanted to get the data from DHI's tool. We were able to get it, but it had quite a number of limitations because of the way it is collected, but also the meaning of the data itself. The good news is that I think we heard recently that the Ministry of Health is in the process of digitization of health facility data. And I think this creates an opportunity for us to see how do we incorporate air pollution data into the HMIs. But even before we do that, how do we in the first place incorporate air pollution as a risk factor for various health problems as part of the clinical consultation process? Because the data that is entered into the DHIS2 is actually from health consultation. So how do we incorporate that? And I think we need to start these discussions. What are the indicators we're going to be looking at? Are we going to be talking about air pollution as household air pollution or ambient air pollution? But also the other sticky part about air pollution data and health outcomes, because you are looking at exposure to particular air pollutants, and therefore, the quality of the data that you collect from the demographics, the geographical location, and so forth, to be able to correlate it with the health outcomes is critical. And so I think we need to move forward and see how do we incorporate, what kind of data do we need to put within the health system to make meaningful conclusions when we analyze it. So the opportunities are there, but I think as people into the air pollution space, we have work to do so that when we approach the health system team, we probably know what we want and then we can work together to start off. Thank you.
Yeah, thank you, Rebecca. Clearly, lots of threads that we still need to continue working on. One final question, again, I'll ask for a rapid response from anyone here, is a question around study design so that we can capture, things like cooking, which will produce smoke, but also other activities. And also, the issue of access to clean fuels. This is part of the question, especially in rural areas where households are settled. And what are your views on increasing access to clean fuels? The question also asks for studies on power interruptions, which again is an important factor in many locations. So anyone either on the expert panel or other experts on the call, thoughts or recommendations on increasing access to clean fuel and study designs that can better help us capture some of this, differences in exposures.
Maybe I'll speak very quickly around access to clean fuels. I think one of the critical things we must appreciate is that there is evidence that if you have clean fuels used for cooking, you can actually improve the air quality and the health outcomes can also increase. I think from the research perspective, what we need to do is to start conducting implementation research. The interventions that we propose, we need to understand the context, we need to understand various factors that would improve uptake. So we need to have clear implementation strategies for different types of households, businesses, rural, urban poor, and all that kind of thing, so that these clean cooking options we can have them be adopted by different people, scalable, and also sustained. So there is a lot of work to do to work with the communities, the users, because at the end of it all, cooking is a behavior. So things around behavioral change have to be very well thought through. I think that's what I'll comment. Thank you.
Yeah, thank you very much, Rebecca. I think some of the major themes, even outside what we see in terms of results of the scoping review or what the evidence tells us, is the need for increased collaboration across countries, across regions. There was also a question here about what can countries in West Africa do, and what can this experience do there. Hopefully, we can do similar assessments in the West African region as well. So if that's something you are interested in, please get in touch. We would love to explore how we can expand some of this analysis to other parts of Africa. I think the other two messages that I would really highlight are what Alex mentioned, which is we have data to take action. And as Rebecca said, some of the evidence from East Africa can also be relevant in other regions. So other regions within Africa. So there's there's evidence and information that can help us take actions today, that can help us increase awareness, inform policy, and also, of course, guide what kinds of research questions and what kinds of data gathering needs to happen. We close for today's session. I want to take a minute to thank all of our expert panel members. 3 of them are on the call here today, Alex, Rebecca, and Cardi. We also have 3 other members who were unable to join due to scheduling. Ajit Khalisa, Kaniba Moindi from Kenya, and also Patrick Katoto from the DRC. All 6 of them have been working with us from the very beginning and have made huge contributions to this work. We hope to continue these conversations, especially around data, implementation, research, and how to use some of this information to build more awareness within East Africa, but also more broadly across the continent. So we really welcome your feedback and guidance, and suggestions that you may have for us. Please also fill the webinar survey that we have included. I just pasted the link in the chat. And then before we close, since we've talked a lot about collaboration and learning within the region, I wanted to flag that in July, there is going to be a Clean Air Forum, which is scheduled for July 15th to 17th. Abstract submissions are still open. So if you're doing work on air pollution and health, air quality management, sources, modeling, consider submitting an abstract. And we hope to see you there to continue this conversation on how to use what we have to take better actions towards cleaner and better health for all. And also, a big thank you to my colleague, Victor Enthusi, who's been leading a lot of this work. And with that, we'll bring today's session to a close, but hope to see you in one of our future webinars or at the Clean Air Forum. Thank you very much for joining us.